Hello, today we're going to be doing a CVC dressing change. So go ahead and start off by coming in. Hello, Mr. Samba. My name is Arista Cavazos. I will be your nurse today. I'm going to go ahead and wash my hands. I'm here to do a dressing change for you. Can you please state your name and date of birth? Okay, Mr. Samba, date of birth 12/3/75. Okay, so during this procedure, what I am going to do is go ahead and lay you flat. I'm going to have you turn your head to the left-hand side, remove your pillow, so that we can do your dressing change. Do you currently have any pain? No. Okay, great. So I'm going to go ahead and wipe my table off at the bedside. Make sure I place my supplies on here. So I have my sterile 4x4, my bio patch, my central line dressing kit, my mask, alcohol swabs. Okay, and then I'll wash my hands again. At this point, I've already removed his pillow. He is lying flat. I've raised the bed to appropriate working height. The patient does have his head turned to the left-hand side. Okay, so go ahead and wash my hands, put my mask on. Put my gloves on. The next thing we want to do is inspect and palpate around the site. So what we're looking for is any crepitus, any bogginess, any discharge, any malodor from the site. So we're palpating. He doesn't have any bogginess, any crepitus. I don't see any discharge or smell any malodor. He does not have any JVD. So now we will go ahead and proceed to remove the dressing. So we have our alcohol swab, and we want to go around the dressing. To be careful not to pull the catheter. And before we start removing the dressing, one thing you do want to assess is the lumens to make sure all the lumens are fully clamped and that there is no backflow to the lumens. So once I've removed almost the entire dressing, minus the bio patch, and cleaned it off, my next step is to get my sterile 4x4, open it, and have it ready. And then I'm going to go ahead and remove the dressing while securing my port here so that it doesn't move. Comes off with the bio patch. This line had tape. We would go ahead and remove the tape as well. And then place our sterile 4x4 on the insertion site. Okay, so now we're going to go ahead and proceed to our dressing change. So we're going to go ahead and remove our gloves. We're going to wash our hands. And we're going to open our central line dressing kit. Made sure that the package was intact, the integrity was still there. Check for the expiration date. So we're opening our kit away from us. And we want to remove our mask. We open up our bio patch. The table's a little small, so I'm trying to improvise. Take out our sterile gloves. Our drape, observing the 1-inch corner. So we want to go ahead and place our drape. Sorry, it's a little hard with the tray. Then we want to go ahead and we want to put our sterile gloves on. And actually what we can do is so we're putting our sterile gloves on. Now we want to place our patch, alcohol swabs, and then iodine packet, measuring tape, and we want to measure in centimeters. So we want to fold at the 0 centimeter mark and scrunch up the rest of it so we can place it on our sterile field. Four by 4 folded in half. And our bio patch we can place in our sterile field. And our tape. So the next thing we want to do is we will grab our alcohol swabs and we're going to open them. We're going to cleanse the site. Go ahead and remove your 4x4. We're going to cleanse the site, starting at the middle area, and we're going to be going all around, cleaning the catheter and the patient very good. And this will extend to the area of where the tegaderm is supposed to be. So that's the first one. This would be thrown away. I'm putting it back into recycle. Same thing with the second one. Go all around, in big circles. We're going from inside out. These would be thrown away. I'm recycling them. And then your third one, also start at the middle. We're going from the inside out. Okay. The next step would be to use the iodine stick. So once again, we need to make sure we ask our patient, are you allergic to iodine, latex, or alcohol? No? Okay, so we're ready to go. So we're gonna use the alcohol swabs to simulate the betadine swabs. So once again, we want to start from the middle. Make sure we clean that middle area really good. Go all around in big circles. We would dispose of the alcohol. Second time, same thing. Start in the middle. We're going all around, making sure to clean the catheter. Okay, and then we do it one more time. Go all around. Okay, so then we'll go ahead and allow that to dry. Now this would typically be in the trash, but I'm gonna go ahead and put it back on my field just so I don't throw it away. So the next thing we wanna do is we wanna allow it to dry, and we're gonna grab our measuring tape and measure the external portion of the catheter. We want to compare that to the previous measurement that the patient had before. So as we're going through and measuring, we can say this one was 1.5 inches. And then compared to the previous measurement of 1.5 a half, so it's about the same. So we would throw this away. So the next thing we want to go ahead and do is get our bio patch, and you want to apply it with the opening to facing down towards the patient. So we have our bio patch placed. Okay, and then we want to go ahead and get our Tegaderm dressing to place on the patient. In this case, the regular size dressing is this one for a regular patient. Because my patient is extra small, I would use a smaller one. I'm using a smaller one actually. I wouldn't. For an adult, we use this size, but because he's just a simulation monkey, that'll cover his entire chest, so we're just using this size. Now, when you're doing this, we want to make sure that we are applying this very snugly, so that it's, you know, applied firmly and it's not loose. We want to place it firmly around the lumen and the bio patch. Make sure it is secure. As you can see, we want to make sure it's completely secure. And as you're pulling your tape off, you want to make sure that this is very secure. We will then get our label, and we will go ahead and write down our initials, date, and time, and place this on the patient. The other thing we would like to do is go ahead and make sure we secure the lumens, so we have a little bit of tape. And this is so that it doesn't pull on the sutures. Okay, and we're done. So then we'll go ahead and return our patient to a comfortable position. We'll go ahead and put his pillow back. All right, so you can go ahead and turn your head and then lower the bed, place him to a comfortable position, give him the call bell to see if he needs anything else. Then we'll go ahead and remove our gloves, remove our mask, wash our hands, and this is after we've disposed of all of our contents. Now, for the removal, if we've already removed our dressing, we've done our cleaning. So we have removed our dressing. We've already cleaned with the alcohol and betadine, let it dry. The patient does not have anything else, anything further attached to him other than here. What we do need is our suture kit. And so for our suture kit, this will also be placed in our sterile field. And you need your 2x2. So here, your 2x2 would be in your sterile area. He would be covered with a 4x4. So then we would get a sterile 2x2. Which we would open up and place this in our sterile field. And so then what we would do is remove the 4x4. Right here where the port is, there's going to be sutures. So we will get our suture removal kit. And what we'll do is, as you're securing the port, you will lift the suture and cut. Same thing on the opposite side. Lift your suture and cut underneath. So if you have 4 sutures here, you would lift and cut, lift and cut. Okay, dispose of those in the appropriate container. And then we will go ahead and tell our patient, okay, what I want you to do is go ahead and take a deep breath when I tell you to do so. And in one swift movement, we are going to remove the tube. Ready? 1, 2, 3. Go ahead and hold your deep breath. Very good. Okay, go ahead and breathe. So then we would apply our 2x2. And you want to apply pressure for 5 to 10 minutes. If the patient is on blood thinners, then you want to go ahead and apply pressure for a longer period of time. And at that time, what we want to do is go ahead and inspect the lumen. We want to make sure that it is intact, that it has not, inspect the catheter. We want to make sure that nothing has broken off, that the ends are intact, no pieces have come off. We measure this with our measuring tape to compare the before and after to make sure that this is intact when it comes off. And so what we do is we keep applying pressure for 5 to 10 minutes. Okay. So after pressure has already been applied to this, then what we'll go ahead and do is get our Tegaderm dressing. So we'll go ahead and place our Tegaderm dressing snugly over the patient, as so. So you want to make sure it's nice and tight. And then we will go ahead and place our label with the patient's with my initials, date and time of change. And at this time, we'll go ahead and return our patient back, give him his pillow back, place him in a comfortable position, lower the bed. We'll go ahead and remove our gloves. And our masks. And then we'll go ahead and wash our hands and proceed with appropriate documentation. Thank you.